And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Amen. Almighty God, who in thy wisdom and goodness has appointed the office of rulers and parliaments for the welfare of society and the just government of men, we beseech thee to behold with thy abundant favor us thy servants, whom thou hast been pleased to call to the performance of important trusts in these islands. Let thy blessing descend upon us here assembled, and grant that we may treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote thy honor and glory, and to advance the peace, prosperity, and welfare of these islands, and of those whose interests thou hast committed to our charge. And this we beg for Jesus Christ, his sake. Amen. May the grace of our Lord Jesus Christ, and the love of God, and the fellowship of the Holy Spirit be with us all evermore. Amen.
Morning, members. Yes.
Confirmation of minutes.
Members, the minutes from March 6th have been circulated. Are there any omissions, corrections, amendments? There are none. The minutes are confirmed as printed. The minutes from the 9th of March have been deferred.
Announcements, messages from the governor,
There are none.
announcements by the speaker,
The only announcement this morning is that we've been notified by MP Leah Scott that she'll be absent today.
messages from the Senate,
There are none.
papers and other communications to the House.
We have one this morning in the name of the Minister of Finance. Minister?
Good morning, Mr. Speaker.
Good morning.
Mr. Speaker, pursuant to the powers conferred by Section 96 of the Constitution, I have the honor to attach and submit for the consideration of the Honorable House of Assembly the supplementary estimate number 1 for 2018-19. Thank you.
Thank you.
Petitions,
There are none.
statements by ministers and junior ministers.
Yes, we have two statements this morning. The first is in the name of the Minister of Health. Minister?
Thank you. Good morning, Mr. Speaker. Mr. Speaker,
Oops, a little loud there.
Mr. Speaker,
Derek? Can we adjust the volume there? A little loud. The echo and back.
Mr. Speaker, and honorable members. I know everyone in Bermuda is getting into a state of preparedness for the potential arrival of COVID-19 to our shores. I want to give this House and my honorable colleagues assurance that the government is taking proactive steps to effectively respond to this global outbreak. Some persons may be aware that the Office of the Chief Medical Officer is ordinarily a small team. However, additional staff have been seconded to the Ministry of Health from elsewhere in government and the Bermuda Hospitals Board to provide additional manpower. Consequently, there is a growing team fully engaged in getting the country ready. For example, I can share, Mr. Speaker, that among the steps completed by the team are as follows. Hand sanitizers have been ordered, which will contribute to the essential hand hygiene needed to protect ourselves and prevent spread. Though we all have to remember, of course, Mr. Speaker, that good old-fashioned soap and water achieve the same aim, so wash your hands often and well. To underscore the importance of hand washing, a video has been produced and disseminated regarding good hand hygiene. The Office of the Chief Medical Officer has provided guidance to various business organizations across the island, including the Association of Bermuda International Companies, or ABIC, the Association of Bermuda Insurers and Reinsurers, ABIR, and the Bermuda Chamber of Commerce, stating actions which can be taken by the business community to help respond to the emerging public health threat of COVID-19. The 911 telephone operators have also adjusted their ordinary protocols with enhanced questioning of callers in order to deal with situations involving a possible case of COVID-19 to ensure that everyone gets the right services and the right care by deploying the appropriate emergency services. At the airport, Mr. Speaker, there is a public health nurse covering every incoming flight. Additionally, supported by their senior managers, customs officers have been questioning arriving travelers, asking the appropriate travel history and health-related questions of incoming passengers in order to identify any person needing additional public health follow-up. A poster has been sent to healthcare facilities to print and display on their doors, advising individuals with respiratory symptoms and/or a relevant travel history to call ahead before entering the premises in an effort to limit any potential exposure risk to others. Mr. Speaker, I truly have to emphasize this point. If you have fever, cough, and difficulty breathing, call your healthcare provider promptly and share your previous travel history. It is important to remember to call first and don't just show up. In addition, Mr. Speaker, the government has created a poster detailing COVID-19 prevention tips. The Ministry of Health is encouraging people to print and display the poster in their workplaces, community clubs, and public bulletin boards. This was issued with a previous press release, but it is on our website for persons to print and religious organizations were sent guidance to share with their congregations to assist in spreading the word about preventative measures the population can take now. Long-term care facilities have also been sent guidance and information to assist them in handling questions and prepare. And a further document has been created entitled Guidance for Hotels, Guest Workers, and Airbnb Operators in Bermuda. Mr. Speaker, the government has been actively planning for cruise ship season based on the threat of COVID-19. All cruise ship lines serving Bermuda have been contacted, and they have shared their individual policies for the health screening of passengers. By liaising closely with shipping agents, government personnel are preparing for the planned arrival of cruise ships to the island. Under the international health regulations, all ships must forward a declaration of health form to the Department of Health, which must be received at least 24 hours before the ship's arrival. The declaration will detail any instances of infectious disease on board and list any previous ports of call. By having this information in advance, we can make decisions based on risk assessments and in line with the international health regulations as to whether or not we need to intervene in any way. We also carry out full inspections of cruise ships on request in order to issue ship sanitation certificates. Mr. Speaker, I have to highlight a reminder that all arriving travelers will undergo a travel risk assessment upon entry into Bermuda and could have their health monitored and movement on island restricted for up to 14 days. Those who have spent time in jurisdictions considered at very high risk will be given health instructions for follow-up and monitoring for 14 days. There are government officers at all ports of entry to assist with managing the situation, and port officials are in continuous communication with the Ministry of Health's Epidemiology and Surveillance Unit. Travel advice for residents and visitors is updated daily on the government's website. Please read the advisories before you decide to travel. We have been updating information to the public on a daily basis to try to ensure everyone knows how to prepare and what to expect. I want to stress, Mr. Speaker, that preparing for and managing a potential outbreak is not a one-agency undertaking. The Ministry of Health is working closely with stakeholders from different disciplines and sectors of society to plan and prepare for this global risk. The ministry's Public Health Emergency Response Team, or PERT, includes representatives from Customs, Immigration, Skyport, and Cedar Aviation to ensure all parties are working collaboratively. In addition, Mr. Speaker, the hospital has been under active preparations to deal with the potential seriously ill and critically ill COVID-19 patients in Bermuda. BHB has escalation plans in place which identify options for emergency, intensive care unit, and acute care wards to cope with an influx of patients in the event of a pandemic. Plans are in place to increase bed capacity if needed, such as postponing elective surgeries, discharging stable patients, and using additional beds in other areas. There are negative pressure rooms in emergency and on each floor of the acute care wing. Negative pressure rooms stop the air flowing out of patients' rooms, keeping the rest of the hospital safe. The hospital also has an entire floor of 30 beds with an independent air filtration system, which can potentially be used for cases should that need arise. Mr. Speaker, I remind the public again that it will be critical for people who can be cared for at home to stay there so that hospital services can focus on those most in need. No one with COVID-19 symptoms should turn up at the hospital without calling ahead first to inform healthcare personnel of their symptoms and receive advice on next steps. The hospital has seniors and people with existing medical conditions who are more susceptible to infection. Moving on, Mr. Speaker. In addition, there are a number of activities underway which should be completed imminently or in the near future, and these include the following, Mr. Speaker. The government is in the process of enabling duty relief measures for hand sanitizers, N95 masks, and other personal protective equipment in the fight against influenza and COVID-19. Once implemented, the duty relief will apply to items imported. An announcement will be made once it is in place. With respect to N95 masks, Bermuda does have a supply for the majority of health personnel, and we are in the process of ordering more. And it is well known that these masks are in global short supply, but we are working to acquire masks as quickly as possible through our international partners. Nevertheless, Mr. Speaker, it should be noted that the use of face masks during outbreaks of viral illnesses such as COVID-19 has only been shown in scientific studies to be effective for protecting healthcare workers and to reduce the risk of sick patients spreading the disease. Based on that evidence, the World Health Organization recommends the use of face masks by 1, people who have respiratory symptoms such as coughing, sneezing, or difficulty breathing. 2, people who are providing care to individuals with respiratory symptoms. And 3, healthcare workers when entering a room with patients or treating an individual with respiratory symptoms. Mr. Speaker, I have to stress that wearing a face mask alone is not guaranteed to stop infections in any of these circumstances and should be combined with other personal protective measures such as hand hygiene and keeping your distance from people who have symptoms. In addition, a rapid response team of doctors and nurses will be created in collaboration with community healthcare professionals to increase capacity for detection and potential cases of COVID-19. Furthermore, additional nurses are currently undergoing training to deal with investigation and case management where there are suspect cases in the community. As I've indicated previously, Bermuda currently sends all of our tests to the Caribbean Public Health Agency to obtain scientifically valid, true, and reliable results that will protect individuals and the community. 4 to 5 days is the standard turnaround time to get a valid result, and so far Bermuda has completed 8 tests to date. The 3 results received were all negative, and we await the others. Mr. Speaker, I would like to reiterate that currently there is no commercially available, scientifically valid rapid test that can provide instant results in the world. However, we are exploring additional testing options in collaboration with our local and international partners, and the government will ensure that tests can be conducted locally at the earliest opportunity. Finally, Mr. Speaker, we continue to work on identifying a suitable quarantine facility for the potential instance of persons who are well enough to self-quarantine but are not residents of Bermuda. And the COVID-19 helpline remains in development as this is a much-needed resource for the concerned public. Mr. Speaker, I want to remind us all that while there are many unknowns about COVID-19, experience to date indicates that about 8 people only have mild to no symptoms and will not need hospital care. Of the rest, a portion will be able to receive medical care at home, and a small percentage may need critical care services with intensive medical management. Therefore, Mr. Speaker, we do not anticipate a situation with COVID-19 that would require the large populations to be relocated. Mr. Speaker, in the event that a case is identified locally, the Ministry of Health will inform the public immediately. We have received several media queries and seen social media posts falsely alleging the existence of local cases. This is categorically untrue, and the public should remember that such information would only come directly from the Ministry of Health. However, in the event of a local case, the way to protect ourselves and prevent community transmissions will be to heed the orders from public health professionals, remain isolated as instructed, and practice the simple measures extensively stressed already. Frequent hand washing with soap and water or use of hand sanitizers, cough into your elbow or tissue, frequent disinfection of surfaces, avoid close contact with cough and fever symptoms, and if you have fever, cough, or difficulty breathing, call your healthcare provider. Don't just show up. Mr. Speaker, this is a matter of utmost seriousness, and it is a time for calm, rational action. Just like we prepare when a hurricane is coming by calmly getting our homes and supplies ready, so too we should engage in calm and measured preparations for a potential COVID-19 arrival. This is not a time for panicked actions or irrational fears. The biggest thing we have to fear is fear itself. Remaining calm in our actions and steadfast in our preparations will ensure that we can properly and successfully manage this global situation. Thank you, Mr. Speaker.
Thank you, Minister. The second statement this morning is in the name of the Minister of Education. Minister?
Thank you, Mr. Speaker. Mr. Speaker, today I stand before you and my honorable colleagues to share some of the exciting and transformative work that is being taken across our primary schools to support and enhance the teaching and learning of mathematics in our primary school classrooms. Mr. Speaker, let me first provide a brief backdrop for my honorable colleagues who will recall back in February 2018 when I shared the Cambridge checkpoint and IGCSE results for the 2017-2018 school year. During a press conference, I advised the public that our students were not performing at the expected, and this was of great concern. Consequently, the following month, in March 2018, two specialists from Cambridge International visited our public schools to conduct observations in math classrooms and to facilitate training sessions designed to improve the teaching of mathematics. I shared at that time with this honorable house during their visit, the Cambridge representatives held focused conversations with our students, teachers, principals, and technical officers. They also visited several schools and made observations while students were learning in their respective classroom environments. Using the data collected, recommendations were made to the Department of Education on where to refocus the direction of mathematics in our public schools. Mr. Speaker, the department's technical officers used these recommendations as data for informed decision-making in alignment with Plan 2022 Strategies 5.33 and 5.33.1. leading to the implementation of a comprehensive mathematics intervention program for improvement of teaching mathematics across all of our primary schools. This intervention program includes extensive professional development training in mathematics for our teachers to enhance and build on the quality of teaching and learning in the classroom, support and assistance for school principals, and ultimately, we expect it to lead to improvement of our Cambridge score results and other mathematics assessment results for our students. Mr. Speaker, during the 2018-19 school year, the overseas consulting firm Primal Academic Innovations Limited was introduced to the mathematics teacher leader at Harrington Sound Primary through a former PTA president at the school. Consequently, financial support was received from the Bank of Bermuda Foundation that facilitated PAI implementing a mathematics intervention program at Harrington Sound Primary School, which included the same essential practices highlighted in the recommendations from the Cambridge representatives. These included focus on conceptual versus procedural understanding, engage students more in talking, thinking, and reflecting, scaffold less so students build independent skills, allow students more ownership for their learning, encourage reasoning and problem solving, exercise questioning, and develop positive dispositions. Mr. Speaker, the mathematics program at Harrington Sound Primary proved to be successful in improving the performance of their students. The school's attainment for the Cambridge checkpoints averaged 2.7 in 2019, with all P6 students included. However, after factoring out the scores of students who required access arrangements, the attainment average increased to 3.2. The attainment was notably higher than the 1.9 in the previous year. Mr. Speaker, the increase in student results at Harrington Sound Primary School was also evidenced by the scores they achieved in the Department of Education's common summative assessments in mathematics that students from P4 to P6 set at the end of the 2018-19 academic school year. The math results for Harrington Sound Primary were significantly higher compared to other primary schools. Mr. Speaker, after one academic year, the mathematics intervention program was contributing to a significant improvement in the results in both checkpoint and international assessment and the national math assessment. Consequently, Mr. Speaker, the Department of Education contracted PIA Limited to build on this success with wider implementation of a mathematics intervention program for all primary schools. The Primal Academic Innovations Limited is a team of school improvement professionals that have a strong track record of transforming schools that have an underachievement in mathematics to becoming centers of mathematic excellence. The PIA team has been responsible for transforming 31 primary schools in the North England and in the Midlands from achieving low standards to exceeding the national average in all cases. The majority of these schools are now ranked in the top 5% of schools in the UK in regards to improved quality of teaching mathematics through training, resources, support, and leadership development, which will also ensure that all schools are sufficiently equipped with support students to improve mathematics. Mr. Speaker, in January 2020, PIA Limited contract commenced to deliver in 3 phases a comprehensive mathematics intervention program for all primary schools. The phases include the following. Phase 1, January to March 2020, training of all primary school teachers on a mastery approach to teaching mathematics and align mastery approach to learning with the standard-based grading program. Develop mathematics lessons resources for every primary school, introduce principles to an observation strategy and monitoring system, and hold parent sessions with every primary school. Phase 2, April to June 2020, further training of all teachers and the provision of lesson plans and teaching resources, direct support for teachers with feedback, and the creation of assessments and support for parents and school principals. Phase 3 includes, from September to December 2020, create a hub of teachers who will lead and assist with math interventions at the primary school level, develop capacity in the public school system to sustain intervention efforts, involve the modification of standard-based grading pacing guides, and review the impact of phases 1 and 2. Mr. Speaker, since January 2020, the CEO of PIA Limited, Mr. Adam Ewan-Berry, has been providing the Commissioner of Education with regular progress reports on the implementation of the Mathematics Intervention Program. The deliverables outlined in Phase 1, which I shared, are nearing completion. In addition, parent sessions have been held at all 18 primary schools, and web pages for every school have been established by principals, teachers, and parents, for access by principals, teachers, and parents. Mr. Speaker, I was very encouraged by the most recent progress report the Commissioner shared with me during the last week in February. The progress report was from the CEO, Mr. Ewan-Berry, and I want to quote an excerpt from his report verbatim as it relates to the P6 Math Booster sessions that were held. And I quote, "The P6 event was a huge success so far. I've had parents coming up to me in shops and in Hamilton all over the weekend telling me how much the P6 event has boosted their child's confidence in math." Mr. Speaker, the P6 booster events are 2-day sessions where a team of math education experts and P6 students across schools are brought together to work in small groups and address specific gaps in math learning. During mid-February, the P6 booster event was held with Prospect Primary, Elliott Primary, and Harrington Sound Primary Schools at Cedar Bridge Academy. The focus was placed on ensuring students understood and had a good knowledge of the content. The team of math experts that assisted with the P6 booster sessions, P6 tutors, and experts. This combination of expertise underscored the effective and sustainable model to raise standards in math for our primary school students. Shared by Mr. Ewan-Berry. What I saw stirred up a pounce of excitement within me. At one point during the session, the students were seated in groups, were in groups sitting around several tables from which it was clear they were discussing and conversing. Then other photos showed them in huddle sessions spread out on the floor with flip chart paper, notepads, and markers. Another set of photos showed some students at the flip chart in front of the room. Mr. Speaker, I saw engagement, I saw interaction, and I saw participation. This is the aim of Plan 2022 Priority 1, which states to increase academic rigor and student engagement. And Strategy 1.1 is to deliver high-quality instructional practices for students that are rigorous and foster knowledge, comprehension, critical and creative thinking, application, and communication. Mr. Speaker, let me also share with my honorable colleagues direct quotes made to Mr. Ewan from students, teachers, and parents about the P6 booster session. Teachers, thank you for igniting the fire in our students. What an amazing setup and so valuable. Students, I never thought I would enjoy a whole day of math. I didn't. I love learning this way. Parents, thank you. My child came home excited about math, and I couldn't believe it. My child had grown in confidence and now says she likes math. Mr. Speaker, this is what we are working towards, progress and transformation. I continue to say, and I will repeat as we move forward on this journey, it only takes one generation to transform our public school system together. Students, teachers, parents, principal, and the community, we will all make this happen. Mr. Speaker, it is expected the math intervention program is to see our primary school teachers deliver high quality mathematics instruction and for our schools to become international centers of excellence in the teaching of mathematics. I believe this is possible. Improving the performance of our students in mathematics is a strategy directly linked to Plan 2022 and the transformation of the public school education. I will provide my honorable colleagues with further updates as Phase 2 and Phase 3 of the mathematics intervention program are rolled out from April to June and September to December 2020, respectively. Mr. Speaker, I also would like to extend my heartfelt thanks to the Bank of Bermuda Foundation for partnering with the Department of Education in funding the mathematics intervention program for primary schools. I also thank school principals and our teachers for their efforts and willingness to work collaboratively with PIA to improve the teaching and learning experiences of our students. This is a start to how our public school system will progress forward on the transformative journey aligned with Plan 2022, the strategic plan for our public schools and for our children. Thank you, Mr. Speaker.
Thank you, Minister. That brings us to a close of the statements for this morning.
Question period.
The question period this morning, we have actually more members have indicated that they'd like to put questions to the Minister of Health in reference to her statement. Minister, the first member we'd like to put a question to you is the Leader of the Opposition. Honorable Member, you have the floor.
Thank you, Mr. Speaker. I'd like to concur with the sentiments of the Health Minister that we certainly, concerning COVID-19, need not panic, but we need to lay in place plans and to inform one another on a daily basis and remind one another on a daily basis of the necessary new changes that we need to make in our lifestyle as we go forward concerning COVID-19. The question I have is, I'd asked a question before when the honorable member gave a statement of when did we start testing at the airport. Now we're hearing also that there is a nurse that is doing an assessment. I'd like to know when had that started? Unfortunately, we're still hearing reports that some people are not being asked pertinent questions. So it'd be good to let the public know that these risk assessments are being done and when it started. And in addition to that, with the assessment, what is the risk assessment that they are doing at the hospital? Is it just a questionnaire, or are we taking people's temperatures? And the reason I say that, Mr. Speaker, asking that question, just to qualify the question, is most people don't want to travel because they're afraid of being quarantined wherever they go. And so it's least likely that some people will say, well, I'm feeling like my temperature's up. At a minimum, we should be taking, I believe, their temperature at the borderline. So that's my question.
Okay. Minister?
Thank you, Mr. Speaker, and I thank the honorable member for that question. I'm afraid I don't have the exact date, but it has been several weeks when the exact questioning, and it's not testing by the customs offices. I'll explain that process in a moment. When a traveler enters in Bermuda, their first point of contact is with the customs. The customs will go through a series of questions such as where have you traveled from, ascertain if they've traveled from a at-risk country, look at the traveler to see whether or not they appear to have any type of illnesses, such as fever or so forth. There is an on-call community health worker that's also situate at the airport. If, upon the observations of the customs officer, as well as the passenger has identified that they have come from one of the high-risk countries, I don't have the names in front of me, but it's all within the public purview, excuse me. If the answer to those are yes, then that person goes to see the nurse. If there are observations, as I've indicated, about fever and so forth, is a special room, a quarantine room, so to speak, at the airport. The nurse takes that person back there and continues another series of questions with respect to assuring, ascertaining the risk. And there's a health questionnaire that is completed, and it speaks about where have they traveled in the last 14 days, such as the countries. They do a temperature check. They ask whether there's coughing, shortness of breath. I'm reading the questionnaire that the nurse goes through for the risk assessment. They ask them, insofar as whilst they were traveling, what were they doing? In other words, have they been around symptoms of COVID? Have they gone to places that had COVID, i.e. working within facilities such as hospital settings, et cetera, et cetera? All that information is collected, and the nurse does a full assessment. If, Mr. Speaker, upon the conclusion of that, and they've gathered all that information and so forth, then the nurse's assessment is such that the person needs to receive medical treatment, then the fire service, which are the first responders, are contacted. They are called in advance to the hospital, of course, like we've said. The person is transmitted to the hospital. However, insofar as the questioning, Mr. Speaker, there is a question that's done by the frontline customs officers, as I said, that speaks to where have they traveled. They will make observations about the person insofar as whether they appear to have flu-like symptoms, sweating, et cetera, and then send them to a secondary assessment, which is done by the community health nurses. I'll see if I can get that question. It's been several weeks that they've been doing this particular process. The protocol is in place.
Supplementary?
I guess just more of a clarification on the question that I asked and the answer I'm looking for. There was two different answers. When did we start questioning at the border, and when was the nurse put in place at the actual airport itself that is backing up? So if I could get the answers to that. I know she doesn't have them right offhand, but if we could get that answer. Supplementary, Mr. Speaker, considering that, as I mentioned, taking people are a bit leery about being quarantined as they visit the island. I was wondering if the honorable member would at least entertain at least doing a temperature test on all incoming folk. Prevention is far better than having to come behind. And if we can screen as much as possible as we look around the world, we can see that they are taking the temperatures of everyone coming through the borders. These temperature type guns are very simple. They just, they don't touch you. They just scan your body temperature very quickly. 2 seconds and it's done.
Sure.
If the honorable member would consider that as being the next phase that she should be moving into, that I think would be great.
Minister?
Yes, thank you, and I thank the honorable member for that question. Mr. Speaker, I can say that the Ministry of Health is exploring all avenues as it relates to prevention, and including in that particular area and avenue, so to speak, is the issue, the investigation of the temperature systems, whether or not it's the handheld one or one that you walk through. There has been, we are exploring all that. In fact, we have a meeting tomorrow with a potential vendor and have also sourced vendors that can provide that particular mechanism. Which mechanism is utilized, I can't speak to at this point, but we are in the process currently of actively looking at a particular thermal scanner and acquiring such a scanner for our ports of entry. So that is actually an active pursuit.
Thank you. Any supplementary?
Second question.
Well, I think one of your members wants a supplementary, right? Supplementary? Yeah.
Supplementary. Good morning, Mr. Speaker. Just following off what the minister's response was, according to having somebody who is actually showing symptoms and going through the questionnaire and then potentially having to be taken to the hospital for further testing. What would happen if that person was showing those symptoms on the aircraft? What about the people that were sitting next to that person? So obviously, if that person is sneezing and coughing, and it seems that a lot of the way of spreading it is going to be with droplets. So the potential of the people around that person, that's the area. So what would happen in that particular situation once the questionnaires happen? How are we going to deal with the people that were in close proximity to that person?
Minister?
Thank you, and I thank the honorable member for that question. Mr. Speaker, what happens to the passenger on the plane? Obviously, there's no, we as a jurisdiction can't control what Delta Airlines does if a passenger is exhibiting symptoms. I do understand, though, from our conversations with the airlines that they generally will try to isolate the patient by virtue of providing them with masks so that they're not, they're isolated in that regard. They can't take them off the plane, obviously, or isolate them on the plane, but they're providing them with a mask. We are all aware of a recent publicized event that occurred in Bermuda recently concerning a similar episode that the honorable member is speaking about. And at the time, the Red Cross, as I said, we're working with our business partners, our community partners, and the Red Cross assisted by providing a helpline for passengers to ask questions if they were concerned. Probably, I guess, within 48 hours, I can't remember, shortly after that particular episode, we did then provide a public announcement to the public to indicate that this individual did not have COVID-19. However, insofar as passengers that may be concerned, when they come through to the airport, we're asking them to just, of course, express their concerns to the health officers that are there, and that to watch themselves. And if they notice that within the next couple of days that they are exhibiting any types of the symptoms that I've spoken about, to call ahead to their healthcare professional and indicate that they may have had exposure by virtue of flying on a plane where somebody was coughing and sneezing. I do also want to remember and remind colleagues that it is flu season. So oftentimes the persons that may be in your vicinity that are coughing and sneezing may have influenza as opposed to COVID. However, again, we're inviting members of the public, if they feel that they may have had an exposure, such as on a plane, and they notice symptoms. So it's not to just call and say, I was on a plane and the person sitting next to me was sneezing. But if you notice that you have elevated temperature, or you're having any type of respiratory challenges, then we are suggesting that you call ahead to your medical facility and indicate, I was traveling last week, I was sitting next to a passenger that was sneezing, I have some concerns because I have some symptoms, and therefore you will get advice from the medical personnel insofar as what next steps.
Thank you, Minister. Supplementary?
Yeah, supplementary. So the issue is that once that person has been taken to the hospital and they're going through the testing, and there's a 5-day period waiting for the test to come back, the other people that potentially were exposed to it have gone home and potentially taken that to their elderly parents. The issue really is, we talk about that 80% of the population are really going to see mild symptoms, but Bermuda has an aging population with people that do have underlying issues. So really, the real fear that I think the population is going to have is that you've taken that home to your aging parents, and you might not know for 5 days that you were actually exposed, and then 14 days later that you actually are one of the people that is carrying it. So if the minister, I understand that the people in that area are going to be told, as it was in that instance, maybe, the following day or 48 hours later, that somebody has been taken to the hospital for this, but we really won't know whether they actually have COVID-19 for another 5 days if they've been tested. So the question is, how are we actually going to deal with step 1 to step 2 to step 3? I understand that we've taken care of step 1, the potential if the person is showing the symptoms, but if you are in that vicinity of that person and you're saying that it might have been the flu, you've gone home and you haven't paid attention to it. How are we dealing with the impact that we can have in a country this size very quickly if we're getting this from one person coming in with COVID-19.
Thank you, Mr. Speaker. If I understand the question correctly, and I probably don't, if
If I make
the
it through
persons
if
that
I
are
make
on
it
the
through
plane,
airport,
I beg
what
your
happens?
pardon?
My interpretation, if I make it through the airport process, what happens when I get home and I realize I have it? That's basically what you're asking?
You'll probably, if you get home and you realize you have it, well, first, you won't know if you have it unless you've had a test. Secondly, you will have symptoms. So if you're experiencing any type of symptoms, respiratory symptoms, elevated fever, coughing, and sneezing, then you're symptomatic. When you have a symptom, then we are suggesting to persons to contact their doctors in advance and indicate to their doctors that they may have been exposed. I have to also say, Mr. Speaker, is that on a scenario of a plane like we spoke about, the other passengers that are on the plane will be contacted. It's called contact tracing. And they will be contacted by members of the community health nurses to indicate, to remind them, A, we want you to make sure that you check your temperature, self-assess whether or not you have any of those types of symptoms, et cetera. So the contact tracing will take place. So that, let's say there was 60 passengers on the plane. One person was exhibiting these type of symptoms that we're all speaking about. The other 59 people will be contacted by public health nurses and will be given instructions such as check your temperature, watch out for signs, watch out for symptoms, et cetera. If you have those, don't go to the doctor directly. Call ahead and say, I may have been exposed. These are my symptoms that I've observed for the last 24 hours. I was on a plane 2 days ago, et cetera, et cetera. So those persons will be contacted by public health nurses to be provided with the information and the instructions accordingly.
Thank you. Opposition Leader, you want to go to your second question now? Oh, you supplementary over his question? Okay, supplementary.
Good morning, Mr. Speaker.
Good morning.
Would the honorable member please just confirm or deny that the testing that has been done on people who have exhibited severe symptoms that could potentially be COVID-19, that the tests that have been provided so far actually even cover the COVID-19, or are they simple influenza tests?
The tests that we have been doing on the 8 patients, the 8 persons is a test for COVID-19. The test is done, the specimen is taken and the test is currently being done by CARFA in Trinidad, the Caribbean Public Health Organization. Yes.
Yeah.
Whether or not those patients have also been tested for influenza, I believe they have, but they certainly have been tested for the COVID-18. 8 persons, excuse me, Mr. Speaker, have been tested. 3 have come back negative, and we're waiting for the results of the others.
Okay. Supplementary?
I have a supplementary. yes.
Supplementary?
My first supplementary is, what is the timeline expected between sending the samples off for testing and receiving the results back? Because presumably the samples themselves have to physically be taken to Trinidad, and then the results can come back by
Minister?
or whatever.
Yes, actually, they're not taking physically to Trinidad. They're doing it all by FedEx and so forth. It takes 4 to 5 days from the moment that sample is taken to the receipt of the receipt of the results, excuse me, between 4 and 5 days. Can I just add?
Sure.
Again, notwithstanding that it would take between 4 and 5 days, we are currently exploring, as I indicated in the ministerial statement, Mr. Speaker, with our international partners as well as locally, the availability to test here on island. However, if a person is being tested for COVID-19, because they are obviously exhibiting symptoms, the advice from the community health nurse would still be, and still is, to self-monitor and remain in quarantine. So if we're sending a test overseas and it's going to take 4 or 5 days for that test to result, you're still in quarantine anyway, because that's the advice, and you'll be monitored by the healthcare professionals. Once we have the ability once commercially available tests are made available, and Bermuda is actively resourcing that as we speak, we will be able to then test here in Bermuda. However, notwithstanding that we're testing locally, that patient is still advised to remain in quarantine.
Thank you. Supplementary?
Yes, thank you, Mr. Speaker. Just referring to just slightly earlier within this section of the minister's response in terms of thermal monitors, how far away are we from actually obtaining them? I know the minister indicated that they were exploring it. I'm just curious how far away a decision or an availability is likely to be had, because we are now, almost 2 months into this epidemic, and I think to be exploring seems like we are probably just, into the situation. It would appear that we could have been a little bit more proactive as opposed to being just exploring now. I'm just wondering how far away are the receipt of the thermal monitors?
Thank you.
Thank you. I
Minister?
thank the honorable member for that question. And as I've indicated previously, this is a time for us to all come together to try to address this issue. And by making false claims, particularly making a claim that this particular issue is an epidemic, is part of the scaremongering that we're trying to
Point of
avoid.
order, Mr. Speaker.
However, Mr. Speaker,
Point of
the
order,
answer
Mr.
to the
Speaker.
question.
We'll take your point of order.
Yes, I think it's important that, I misspoke and I immediately corrected the misstatement. So I think that it's important, as opposed to being, I immediately corrected the misstatement.
Mr. Speaker, with
said
respect to the
situation
question concerning
rather
the
than
thermal
epidemic.
monitoring, as I've indicated, that is being explored. We have another meeting with a local provider tomorrow. It's been the person that's been addressing all the procurement of the items that we need in Bermuda, such as the PPEs, the masks, and so forth, are also in the process of procuring the thermal monitors. I cannot speak with certainty whether or not it's going to be a handheld or one that you walk under the walk through, but they are looking at that as we speak, and they are procuring those. Which type it's going to be, I don't know, but it will be some mechanism for monitoring the temperature of persons arriving into Bermuda at all ports.
Thank you. Opposition Leader, would you like to put your second question now?
The, I have a bunch of questions. Second question, you mentioned the hand sanitizer shipment coming in, and I was just curious, exactly who is that shipment for? Is it for civil service or who is this hand sanitizer for?
Mr. Speaker, the hand sanitizer, as I mentioned previously, I think in one of the other earlier statements, will be distributed A, to the public, B, to persons like nursing homes and so forth, as well as to civil servants. We're in the process of, it's actually en route. I believe it's going to land any day now, but it is en route, and it's going to be made available to the public. There are other companies that we've also been in discussion with that are also going to be bringing in further supplies that are required. But these ones that we're bringing in from the government are going to be obviously distributed free of charge. I'm not saying that that's not going to be the case with the other industry partners that are bringing in hand sanitizer, but it's just going to be distributed for whoever needs some.
Thank you. Supplementary? No supplementary. Third question? No more? We move on to Minister to the next member who wants to ask a question. The member from constituency 22, MP Pearman, would you like to put your question?
Thank you, Mr. Speaker, and thanks to the Honorable and Learned Minister for her very helpful statement today. What we've understand you to say is that there are no confirmed cases in Bermuda at present, that there have been 8 tested, 3 tested, have proved negative, and 5 are pending. And most importantly, Minister, what I've heard you to say is not to panic and the importance of isolation in the case of symptoms and hand washing. My question is back to test kits. Your indication is that at the moment, the testing being carried out in Bermuda, as I've understood you, is that they're currently being sent to the Caribbean Public Health Organization, and within 4 or 5 days, people are having a response. My question concerns your statement at page 10, where you say, I would like to currently reiterate that currently there are no commercially available, scientifically valid test that can provide instant results in the world. I was just looking at the CDC website, which does seem to suggest that there are, in fact, real-time swab kits. And my understanding, and let me stress it's my understanding, I may have misheard, but I thought that the House was told on Friday that test kits had been ordered and would be arriving on the island on Tuesday. Again, let me stress that is my recollection. If I'm wrong about that, I'll stand corrected. But could you just clarify what test kits were being ordered, if they were being ordered, and whether these test kits are different from real-time swab kits? And Minister, the reason I'm asking is that knowledge is power, and that unknown causes fear. So clarification would be most welcome on this point.
Thank you. I
Minister?
thank that honorable member and honorable and learned member for his question. Just two things real quickly, Mr. Speaker. There was a question previously asked about whether COVID, whether the persons that have been tested, and 8 in total, like I said, have been tested. 3 have come back negative. All 8 were tested for both COVID-19 and influenza. Secondly, and I don't want to make light of this. However, Mr. Speaker, when it comes to the testing, when we indicate, when they say a rapid test, I think what persons have to understand, and I'm not trying to make light, it's not a pregnancy test. So they're not doing something and then you wait 30 minutes and you see if it's a blue or a pink line. The rapid test still requires validation. So you can't do a swab and then, so rapid is relative. What they do have, because it takes 2 days to analyze the results. They've got to, and I'm not a scientist. I'm a lawyer, but I am not a scientist. But it takes 2 days for them to actually do the sample, run it, and to make sure that they have a valid result. So the testing would never have represented last week, Tuesday. And the honorable member did say he may be mistaken. If I did, that was incorrect. And maybe I would not have misspoke. Because we knew we wouldn't have them, because the Public Health England is who we've been dealing with, and we're trying to still make sure that we can get a commercially available test. However, when I say rapid, let's be real, it is not a pregnancy test where you're going to receive the results in 30 minutes, because it takes 2 days to analyze it. 2 important features that I have to emphasize. Whilst it's being analyzed and whilst the test has been sent overseas currently, like I said, we will be getting it in Bermuda, you're still in quarantine. So you're in quarantine whether or not it's going to CARFA in Trinidad to be analyzed, or whether we're analyzing it down the road in Bermuda, which is the intent. And again, we have been sourcing test kits that can work with the actual products that are on island, the machines, the PCRs and the equalizers and all those things that are on island, so that we can get the test here. There are, in the United Kingdom, it's a particular microbiology system service. They have 60 in all of the United Kingdom for a population of 65 million. So we are looking to get this, but I want to make sure that honorable members recognize that when they say rapid, it's not like swab and test. You're not like sometimes where the doctor's office have a test and you can look at it, and if it turns blue or green, then you can say if it's positive or negative. Because what we do not want is to be looking at tests that are not validated and a person has a false positive or a false negative. So we have to do this right. We recognize that people want to know. When you see what's going on, you see it, like, for example, there's somebody sent me a note of I think it was in China, and they were like, oh, they're testing 10,000 people a day, da, 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 da. It takes 3 days to get the results. So yeah, it takes 10 minutes to do an inside swab, but they still have to wait for the test results. So as soon as they are available, I would expect to be in a position in the next, certainly by this time next week at the latest, to be able to indicate to honorable members and the public, this is the status. I'm expecting that is imminently. I don't want to speak out of school because I'm waiting for the contract, but we are on the cusp of being able to, we've negotiated it, and we're on the cusp of going ahead and ordering it and pushing the trigger to get the test here. But in the meantime, I do want to reemphasize, so forgive me, Mr. Speaker, for sounding repetitious. If a person has the symptoms and is going to be tested, whether it's going to take 5 days to send it to CARFA or 2 days to be tested down on Queen Street, the reality is you're still going to be quarantined and you're still going to be checked by a health officer.
Thank you.
Supplementary.
Supplementary?
I thank you for the minister's answer. And indeed, my colleague has just mentioned to me that the reference to Tuesday may have in fact been from the Premier, not from the minister. So anyway, I was working from memory. I would refer the minister to the CDC website, which does seem to suggest, and I've just read the passage, I can certainly pass it to the minister, that there are real-time swab tests. I'll leave it there because the important point, I think, is the minister's answer. This is my question. So did I understand the minister to say that it is the government's intention to try to have on-island testing? And when will that decision be taken? Would you say?
Thank you, Mr. Speaker. Mr. Speaker, I thank the honorable member for his question. I am supported by a very, very talented team that are committed to this particular process. This is not their first rodeo, so to speak. They were the same team, the epidemiology and surveillance team were around for Ebola and SARS and the host of other transmittable diseases that have been coming through. So we are very familiar with what is out there. I'm not suggesting for a moment that the honorable member, I know the honorable member would have seen a rapid test, but I just need colleagues to understand. It's when they say rapid, the swab takes probably 2 seconds to swab your nasal passage or your inside of your throat. But the results, in order to get the results, so it is rapid, the test is rapid, but the results are not, because they have to do the analysis, and the analysis of that 2-second swab takes approximately 2 days. So I just want to make sure that, because this is a very good question, because people want to know that, and they see on TV people getting swabbed and they think that the swab is going to give them an immediate result. It will not, because the analysis itself is going to require 2 days. It is not a pregnancy test. It's going to take 2 days, Mr. Speaker, for the analysis. And insofar as the government has committed to getting the test mechanisms as well as the actual test on island so that we can test locally as opposed to sending to CARFA, I may be in a position by the end of the day to be able to update members, because literally as soon as we're done here, I'm going back to the ministry to find out the status. But we have already secured a facility that has a commercially available test. It is called Rapid, my honorable and learned friend, but Rapid means 2 days. And we will be having it in Bermuda, and we're sourcing it as well as the equipment that's needed, because I want colleagues to also understand there is equipment needs to do the testing and to do the analysis and to do the extraction. So it is a process. So you have the test kit, and then you have the equipment that supports it. So it is a process. We've been exploring that for 10 days now. We have secured a particular, we're in the process of finalizing that. But I just need everyone to know that the science has to also catch up, because what we do not want is to get a test kit that has not been validated, that has not been approved by the FDA or the PAHO, Public Health Organization, or the World Health Organization, because that would be a disaster. If we get a test that's not validated and the person it says that the person has COVID-19 and they stayed home for 2 weeks and they did not have it, we can appreciate the potential economic downfall. Likewise, if we get a test that's not been validated and it says negative and they're positive, it goes back to the honorable member from 31, concerned with respect to the spread. So we have to make sure that what we get is FDA approved, World Health Organization approved by PAHO, internationally accepted, that will be able to have a valid result.
Thank you. Supplementary?
Yes, Mr. Speaker.
Yes.
The minister mentioned about the fact that we have people that have been involved in this, and this isn't the first rodeo. And then that just reminded me that in the past, especially with SARS, one of the things that we were able to do, which the minister in Barbados said that reminded me, that we have a system which allows us to know where people have been, so that if people have been in areas where perhaps we have some concern, you could go, the government can go and see where they've been, and then not just rely on them to say, well, I haven't been in any area that's suspect, but the government could actually see that through the airline system, whether they have been. So have we done anything to put that into place? Because I know that it was something that Bermuda had when we're dealing with SARS.
Minister?
I can't answer that, Mr. Speaker. I'll have to confirm with the team, because I don't know that there's any type of system. We do have, when the ships come in, we have the certificate from Port Health that will indicate where their passengers have come in before they arrive to Bermuda. I also know that the United States also provides us information for passengers that are traveling through the United States as to where that person came from. But insofar as from other jurisdictions, I'd have to get that information and revert to the honorable member.
Thank you. Your third question?
Second question. The other one was a supplementary, and I'm
Okay.
only entitled to two, I believe, but,
Yeah.
and this is my final question.
All right.
I thank the honorable and learned health minister. I think it really is useful to hear from you and for this to be shared with Parliament, because it is our opportunity to share this further with the public. And the more the public knows, the less there is a risk of unnecessary fear. You very helpfully identified steps being put in place by the government to streamline the arrival of hand sanitizers and masks, and you identified duty relief. Presumably that duty relief bill will be brought to Parliament and supported by both parties as soon as possible. Do you have a time frame on that?
Minister?
On the order is probably all that's necessary for duty relief, but
Mr. Speaker, I don't have a time frame. We're actually today. Look at that. The Minister of Finance has just indicated that the order is coming today. So thank you.
thank you, Mr. Speaker. Grateful.
No further questions from the member from 22. The next member who's indicated to have questions is the member from constituency 31. Would you like to still put your questions?
Yes, thank you, Mr. Speaker.
Go right ahead.
Once again, we obviously are not trying to get fear with this. We're just trying to get information because the population is feeling anxious, mainly because the international news is showing quite a different outlook than where we are presently in Bermuda. So my question is around, we've seen some major changes in how people are dealing with large gatherings. So in particular, sporting events. In some jurisdictions, you're seeing where there's not going to be fans in the stands. There's some changes in how people are dealing with locker rooms. My question is, when we are dealing with major events coming to Bermuda shortly, Carifta Games and the triathlon, we also have teams that will be leaving Bermuda and going to other jurisdictions. There is a couple of teams recently that have decided not to come to Bermuda because of issues with COVID-19 from where they're coming from. Can the minister give any information on how the health department, along with youth and sport, is dealing with the potential of changes to sporting events locally and teams traveling overseas?
Thank you. Minister?
Thank you, Mr. Speaker. Mr. Speaker, again, as it relates to the information that we have within the ministry, which is coming from the World Health Organization, Pan American Health Organization, as well as CDC. So those are our international bodies. And what we're doing is monitoring, thank you, we're monitoring the information that they are providing to us. And as it relates to certain jurisdictions, we have issued travel advisories to persons not to go to those particular jurisdictions, whether or not it's for a sporting event or visiting, et cetera, et cetera. The PERT team, the public health PERT team in Bermuda also is working hand in hand with the EMO, and there's the disaster risk reduction mitigation team. And I can't call the gentleman's name right now, who is actually in charge of an aspect of that team, a subgroup Lyndon Rayner, that are tasked with working with organizations such as sporting clubs and so forth to make accurate information about the position that Bermuda is in, which again is ranked low, rated low, as to whether or not they wish to continue with respect to the sporting group. So that particular group has been tasked with liaising with sporting groups and organizations as to whether or not they wish to continue. I couldn't stand here and correctly say that it's business as usual, because we recognize that we are in a very challenging time right now. The government is committed to doing what we can to address this issue. However, we do recognize that there will be an economic impact, and there will likely be events that are going to be canceled, and persons will choose for a number of reasons not to participate in that particular event. However, At this point, the government has not made any decisions, as to whether or not they plan on imposing travel restrictions coming into Bermuda from various passages, or alternatively, whether or not we wish to cancel any type of public gatherings, sporting events, and so forth. Those are discussions that we are having ongoing. The FERT team meets very regularly. In fact, part of the team, the medical part, a medical group met this morning, and I was briefed, and those are discussions that we will be taking to cabinet next week as to whether or not we wish to go ahead and start considering canceling certain types of public events.
Thank you, Minister. Do you have any further questions? No further questions? The Officer Whip is the last member who indicated that you'd like to put some questions to you, Minister.
Thank you,
Madam
Mr.
Whip?
Speaker. Thank you. My question is around unexpected diversions to the island. So if an airplane is diverted to Bermuda because someone who may have had some symptoms before the flight and then got on the flight and the fever came back and was escalating, what is the procedure for an unexpected flight that could divert to Bermuda with someone who has symptoms that could be reflective of the COVID-19? And I'll just ask that.
Minister?
Thank you. Thank the honorable member for that question. That is a scenario that has been discussed heavily in the FERT team. And what is expected and anticipated is that, well, first let me back up, because our airline partners now, we obviously can't control what they do on the outside in other jurisdictions, but our airline partners are actually starting to question individuals before they get on the plane and making the same questions that customs are asking upon arrival in Bermuda. They're also asking passengers as they get ready to book the plane, making observations about illnesses and so forth, because they certainly don't want that passenger obviously traveling as well. However, in the circumstances like the honorable member just mentioned, what would happen is that the first responders would attend at the runway. That passenger would be removed from the plane, treated and or taken to the hospital, depending on their circumstances, and then the plane would continue on. The rest of the patients would unlikely be, they would continue on to their next stop. They would, beg your pardon? Patients, sorry. The patients, the rest of the passengers, the other passengers would continue on. It's similar to when they have a divergence now where there's a person that has a heart condition. They stop, the medical responders are there, they take them off the plane to address whatever, and then the plane continues on.
Thank you. Supplementary? Supplementary, yes?
Yes, thank you. So my supplementary question would be, do we have the equipment for the professionals, the first responders that would provide the protective gear needed should they have to face an unexpected emergency such as this?
Thank you, Mr. Speaker. It's called PPEs, personal protective equipment, and we do have quite a supply on island. Admittingly, though, Mr. Speaker, the N95 mask has to be fitted. They have to test fit them, and the size medium is almost like a size 7 shoe. It's quite popular worldwide. Size 7 for women. It's popular worldwide, so we are trying to secure those. The first responders have PPEs. The nursing staff, community health have PPEs, but we're ordering more in order to ensure that we have full supply. That has already been sourced from a supplier here. He's already procured it. We're getting ready to we're looking for a location so that all of the PPEs and all of the things that we need, hand sanitizers and the like, is at one location so that people can go and access it accordingly. However, as I said, the size N95 medium is in short supply, but we are doing our best to source it from other jurisdictions. Just as on an aside, there's the company that makes them is called 3M. And in order for them to it's a U.S. company, they make them in the United, well, I don't know if they make them in the United States, but it's a U.S. company. In order to export them out, they have to have permission. So they're kind of holding on to their things too. So it is a worldwide phenomenon. One of the companies that we're looking at is in Far East, but the procurement, I have somebody Ministry of Health has somebody that's dealing with all of the procurement of those particular items, but certainly our first responders and our health personnel have those PPE sets.
Thank you. Thank you, Minister. No further questions? Oh, yes.
I'd like to ask the minister if the Lamfogo Clinic has ever been considered as a site in the event that we need to quarantine or for acute cases. I wouldn't know necessarily what the source of the use would be, but whether that has been considered as an off-site location.
Minister?
Mr. Speaker, I thank the honorable member for that question. Certainly, the Lamfogo site is a medical facility, so we would not consider that to be a appropriate site for the quarantine. However, in circumstances, if we obviously require more medical attention for local residents, then that would obviously be a facility that would be continually used for that purpose, but certainly not for quarantine.
Thank you. No further questions? That brings us to a close of the question and answer period, and we can move on.
Congratulatory and/or obituary speech.
Would any member like to add a condolences or congratulatory remark? There are none.
Personal explanation.
There are none.
Notice of motions for the adjournment of the House on matters of urgent public importance.
There are none.
Introduction of bills.
There's one bill this morning, in the name of the Minister of Finance. Minister?
Mr. Speaker, I am introducing the following bill, which according to section 36(3) of the Bermuda Constitution requires the governor's recommendation so that it may be placed on the order paper for the next day of meeting, the Customs Tariff Amendment Act of 2020.
Thank you, Minister.
Orders of the day.
We're now on the orders of the day, and members, as you know, we are here to resume the in-committee of supply for the further consideration of the estimates and revenues and expenditures for the year 2021 rather. And this morning, I believe it's Labor Community Affairs that are first up, and they have 4 hours for that debate. And then we'll have the second half, will be Legal Affairs, and they'll have 4 hours for that debate later in the day. The chair this morning will be handled by MP Terrell. MP Terrell, after the Minister of Finance moves us into committee, you can come and resume the chair. Minister, would you like to move us to committee?
Mr. Speaker, I move that the House do now resume in committee revenue and expenditure for 2020-2021.
Any objections to that? No objections? We're so moved. Thank you, Minister of Finance. MP Terrell, would you like to come forward and take the chair?
Good morning, honorable members. We are resuming now in Committee of Supply for further consideration of the estimates of revenue and expenditure for the year 2020/2021. Heads 20, 60, 52, and 71 are now to be debated. I call on the minister in charge to proceed. Minister, you have the floor.
Thank you, Chair. And I move the following heads: 20, Youth, Sport and Recreation; 60, Workforce Development; 52, Community and Cultural Affairs; and 71, Ministry of Labor, Community Affairs, and Sports Headquarters be now taken under consideration. Yeah.
Proceed.
Thank you. Thank you. Mr. Chairman, indeed, I am pleased to present the financial year 2021 estimates of revenue and expenditure for the Ministry of Labor, Community Affairs, and Sports. Mr. Chairman, I will briefly discuss the ministry as a whole, followed by information for Head 71, the ministry headquarters, and then in detail, the 3 departments that fall under the ministry. Namely, Head 20, the Department of Youth, Sport, and Recreation; Head 52, the Department of Community and Cultural Affairs; and Head 60, the Department of Workforce Development. Mr. Chairman, 4 hours have been allocated for these heads, and I intend to speak for approximately 2 of those hours in order to give sufficient time for the opposition to ask questions or seek clarification on the 2021 estimates of revenue and expenditure. Mr. Chairman, when I last presented the budget for this ministry, I was new to the ministry, and the budget and programs had been defined by the former minister. The ministry portfolio has also been changed with the removal of the Department of Financial Assistance, National Drug Control, and Child and Family Services, and the addition of the Department of Workforce Development. Mr. Chairman, I have now had the benefit of just over a year in the restructured ministry and had an opportunity to review the programs and budget and realign them with our mission, a new mission. This involved not only a review of the ministry headquarters, but the individual departments and their programs. Mr. Chairman, our mission for the restructured Ministry of Labor, Community Affairs, and Sports is to develop and celebrate our people. Mr. Chairman, the mission statements, programs, and budgets for the departments within the ministry are aligned with this overriding mission, and their mission statements reflect this mantra. You will note throughout my presentation today our mandate for the development and the support of our athletes, creatives, and workforce, and the importance of this plays in our community. Mr. Chairman, before I get into the details of the budget, I want to share with this honorable House some of the priorities of the ministry for the next financial year. There are a number of policy initiatives that I will be delivering, including a minimum and living wage for Bermuda. The legislation is in place and the Wage Commission are in effect and have begun their work. I look forward to receiving the Commission's report and recommendations for a minimum and living wage so that we can move forward with the implementation. Pay equity. In addition to the living wage, pay equity for Bermudians and salaries that reflect their investment in education and training will be another policy initiative to be delivered in the next financial year. Labor law codification and modernization. I will shortly be bringing legislation forward for this purpose. In essence, the project will deliver 2 bills. The Labor Law, Trade Union and Labor Relations Consolidation Act 2020, which codifies and modernizes the Labor Disputes Act 1992, the Labor Relations Act 1975, and the Trade Union Act 1965. And second, the Employment Amendment Act 2020. This will modernize the act and align it with the labor law amendments. Grants and contributions make up 28% of the ministry budget and will be allocated to where there is a real financial need in programs that align with the ministry and department's missions. We will ensure value for money from our partners in these programs. Increased training and apprenticeships opportunities align with the workforce development plan. The budget for this is being increased by $25,000 from $395,000 to $420,000. Increased overseas scholarships targeted at those with real financial need and from traditionally economically disadvantaged segments of our community. The goal is to ensure social mobility to disadvantaged families with scholarships for courses aligned with the needs of industry so that graduates have better prospects for employment and a career following graduation. The budget for this is being increased by $100,000 from $350,000 to $450,000. Improved race relations. The ministry is also working with stakeholders and the community to highlight the legacy of race relations in Bermuda and define how we can move forward together as a community to improve race relations and assist those that have traditionally and economically been disadvantaged. Mr. Chairman, again, our mission is to develop and celebrate our people. Mr. Chairman, I would now like to draw your attention to page B250 of the estimates book, where you will note that the Ministry of Labor, Community Affairs, and Sports budget for the financial year 2021 is $18,678,000, a reduction of $187,000 or 1% from 1920 original budget. This reduction in budget reflects the moving of the permanent secretary post to cabinet office, where the post is now budgeted. This move is not just for this ministry. All permanent secretary posts are now attached to cabinet office for administrative purposes. Mr. Chairman, page B250 shows a revenue estimate for the ministry of $701,000, an increase of $72,000 over financial year 1920. The increase primarily relates to Youth and Sports Head 20, which will be discussed in detail under that head. Mr. Chairman, page B250 also details the current account expenditure of departments that make up the overall budget for the ministry by head as follows. Head 71, Ministry Headquarters, 1920 fiscal year, financial year, $2,218,000. The next fiscal year, 2021, $2,191,000. Head 20, Youth and Sport Recreation, year 1920, $10,109,000. Year 2021, $10,109,000. Head 52, Community and Cultural Affairs. For this current fiscal year, the budget was $2,242,000. In 2021, it will be $83,000 million, sorry. Head 60, Workforce Development, it was $4,296 million in 1920. And in 2021, it's $4,295 million. The ministry total, as stated before, in this current fiscal year, $18.678 million, a decrease from $18.865 million from the current fiscal year. Mr. Chairman, the summary shows that 2021 estimates for Head 20 has not changed. Head 71, 52, and 60 have seen some reductions. I will discuss each change as I speak about each head. Mr. Chairman, it is worth noting at this point, as can be seen on page C20, that the budget for the ministry includes some $5,286,000 in grants and contributions. This is a decrease of $266,000 or 5% when compared to the original estimate of 1920. It should be noted that this follows a 10% increase in grants and contributions the previous year and is almost 28% of the ministry budget. This reduction in grants is a net change primarily owing to the budget for the summer students in workforce development summer employment for college and university students being moved from grants and contributions to wages. The grants and contributions include $1,505,000 for scholarships, apprenticeships, and workforce training. $3,235,000 for sports development, national sporting bodies, and youth organizations. $470,000 for community and cultural activities. Mr. Chairman, this aligns with our focus on developing and celebrating our people in 2021 financial year. Mr. Chairman, pages C23 and C24 highlight 18-19 budget year actual allocations made to sports development and voluntary youth organizations and total $1,914,000. Mr. Chairman, under Head 71, which is Ministry Headquarters, I now turn to the current account expenditure for the ministry. Mr. Chairman, the objectives of the department are the development and implementation of policies that enhance the lives of the people of Bermuda. the fair treatment of employees and employers, to ensure that the departments within the ministry deliver on their objectives and comply with the relevant legislation, policies, and procedures, Mr. Chairman. Mr. Chairman, the financial year 2021 estimates of expenditure and revenue for Head 71, the ministry headquarters, is found on pages B251 and B252 of the estimates book. Ministry headquarters is responsible for the budget of 2 business units, the first being 81000 Administration, which consists of mainly salaries, administration, and grant expenditure, and the second being 81040, the Labor Relations section. Mr. Chairman, the ministry headquarters mission is to develop policy and provide guidance for the ministry while promoting stability within the labor force. This includes providing policy direction to ensure good fiscal control and service delivery across all departments within the ministry. Mr. Chairman, page B251 shows that the total budget estimate for the ministry headquarters for year 2021 is $2,191,000, split between business units 81000 Administration, $1,444,000, and 81040, the Labor Relations section, $747,000. Mr. Chairman, there is an overall reduction of $27,000 in this budget, or 1%, whilst there has been a reduction in the administration business unit 81000 of $86,000, or 6%. There has been an increase in the labor relations business unit 81040 budget of $59,000, or 9%, to more accurately reflect the cost of this work, including increasing legal costs. Mr. Chairman, I will now address the combined subjective analysis of current account estimates for business units 81000 and 81040, the ministry headquarters, as found on page B252. Mr. Chairman, in business unit 81000, there is a reduction in employee numbers, with the full-time equivalents reducing by 2 from 12 to 10 to reflect the move of the permanent secretary post I spoke of earlier and not funding an accounts officer post. This was in part owing to the restructuring of this ministry and the moving of departments to other ministries. In addition, there are 2 staff on long-term secondments to support the transition until management services have completed their review of the ministry. There is a corresponding reduction in salaries, wages, and other personnel costs of $199,000, or 11%. Mr. Chairman, training and travel have been reduced by $20,000 and $11,000 respectively. This will not reduce opportunities for staff training, but provide for a more focused training program tied in with staff forward job plans. The priority is to ensure staff maintain professional designations through continuing professional development and to provide opportunities for staff to get further training and qualifications to develop them for promotion through the public service. Mr. Chairman, there has been no change in the communications estimate, which remains at $24,000, and the advertising and promotion budget has been reduced to $0, as there are no funds needed at headquarters for this purpose. Mr. Chairman, there has been an increase in the professional services budget from $149,000 to $369,000, an increase of $220,000, or 148%. This increase is to properly reflect the costs of the labor and employment tribunals and legal fees required for external legal representation for the tribunals on appeals. In addition, funds have been budgeted for consultants as required for both the minimum living wage and pay equity projects. Mr. Chairman, there have been minor changes of $1,000 respectively in the repairs and maintenance and energy budget and a $7,000 reduction in the materials and supplies estimate. These changes are a result of a more detailed and accurate estimates being established under the zero-based budgeting process. Mr. Chairman, the last two object codes in subjective analysis are other expenses and grants and contributions. Other expenses relate to bank charges and cable services. There has been an increase of $4,000 to reflect the proper budgeting of the cable to this account. The grants and contributions have been reduced by $2,000 or 3%. These are discretionary grants that the minister may award for one-time events that are not captured by departments' grants within the ministry, provided that the event is one that is aligned with the mission of the ministry. Mr. Chairman, whilst I have already highlighted the priorities for the ministry, in order to provide some context for budgetary figures shown in the subjective analysis of current account estimates, I will at this time describe the activities of the Labor Relations section. Mr. Chairman, the Labor Relations section of the ministry is responsible for the investigation and mediation of labor disputes in both unionized and non-unionized environments. The section provides an impartial and free service to employees and employers and their respective representative, and to the general public in the form of consultations, and refers unresolved labor employment-related disputes to the necessary tribunal or arbitration panel for adjudication. The section is also tasked with oversight of certification and decertification of unions in the workplace. The section's aim is to promote dispute resolution and prevention, and to encourage and facilitate management employee engagement in line with best labor practices. The manpower estimates for the labor relations section, as outlined on page B252, are 6 full-time posts, which remain unchanged from 1920. Mr. Chairman, during the 1920 budget year to date, there were approximately 686 labor dispute inquiries lodged, and the labor relations section, of which 614 were consultations and 72 were complaints. 50 were complaints filed pursuant to the Employment Act 2000, and 22 were grievances reported pursuant to the Labor Relations Act 1975, Trade Union Act 1965, and/or the Labor Disputes Act 1992. Mr. Chairman, the majority of complaints filed and investigated by the labor relations officers related to terminations and outstanding wages at 30 and 24 complaints respectively. The remaining 18 complaints consisted of complaints regarding constructive dismissal, vacation pay, reduced work week, overtime redundancy, collective bargaining agreement procedures, and certifications. Mr. Chairman, a total of 58 complaints have been resolved during the 1920 budget year up to January 31st, 2020. 25 relating to complaints filed during the budget year up to 31 January 2020, and 33 carrying over from previous years. There currently remain 51 active cases within the labor relations section. Of this, 6 are cases over 12 months old as at January 2020. 9 are cases between 6 and 12 months old, and 36 are cases less than 6 months old. Mr. Chairman, during the 1920 budget year, 19 complaints were referred to the Employment Tribunal, with 10 matters completed and awarded decisions. Of these, 3 were settled in favor of the employee, 5 in favor of the employer, and 2 were settled between the parties without the need for an employment tribunal hearing. Under major achievements, Mr. Chairman, the labor relations section has seen an increase in the number of disputes resolved through conciliation and mediation, a reduction in the number of outstanding disputes, and a reduction in the number of complaints filed due to the section's efforts to educate the labor force, including employers and employer groups, on their rights and obligations under the legislation. Mr. Chairman, the Labor Relations section worked closely with the Attorney General's chambers to effect amendments to the Employment Act 2000 with regards to vacation leave, maternity, and paternity leave. For the first time, legislation has afforded fathers the right to paternity leave of 5 days unpaid if they have worked for less than a year, and 5 paid days if they have worked longer than a year. Paid maternity leave has been increased to 13 paid weeks for those employees who have worked for 1 continuous year, and 13 unpaid weeks for employees who have worked for less than 1 year. Mr. Chairman, the Labor Relations section continues its collaboration with the Department of Communications to provide the public with pertinent information regarding the legislation that it administers via print and media outlets. As a result of this continued initiative, the general public, employers, and employees alike are more aware of their rights and obligations under the relevant legislation and know where they can go to get assistance and advice. Plans for the upcoming year, Mr. Chairman. As part of the legislative platform for this government, and as a key resource for servicing and educating the Bermuda workforce, employers and employer groups, unions, and private sector representatives. The Labor Relations section, under the direction of the Minister responsible for labor, has been working closely with the Attorney General's chambers to ensure that the reform of the labor legislation and amendments to employment legislation are fully implemented and adhered to by Bermuda's labor market. The section continues to offer seminars, workshops, and presentations to employer groups, worker groups, and individuals in an effort to broaden the understanding of good employment practices. Additionally, with the passing of the reformed labor legislation, the Labor Relations section will expand its campaign to educate the public on any new and revised legislation with the specific aim of reducing labor-related complaints, ensuring that parties feel supported on matters of importance, and handling of all matters expeditiously. The Labor Relations section will continue to foster a close relationship with government departments, stakeholders, and employer groups to ensure continued cooperation and consultation for the enhancement of sounder industrial relations among employees, employers, and unions. Mr. Chairman, I would like to recognize the Labor Relations Manager, Ms. Gabrielle Akan, and her team for their impartial work over the year in their mediation of labor disputes and promotion of the fair treatment of both employers and employees. Mr. Chairman, I would like to take this opportunity to thank all of the dedicated staff of the ministry headquarters for the work they do in ensuring that the ministry meets its mandate. Mr. Chairman, this concludes my presentation on financial year 2021 budgetary allocation for Head 71, the ministry headquarters, and I will now move to Head 20, the Department
Minister,
of.
Can I just interrupt you for 1 minute,
Yes,
please?
you may.
I'd like to recognize the presence of the students from Delwood with their teachers as well. Thank you all for coming. Minister, please proceed.
Sure. I will just reread that last sentence. Mr. Chairman, this does conclude my presentation on financial year 2021 budgetary allocation for Head 71, the ministry headquarters, and I will now move to Head 20, the Department of Youth, Sport, and Recreation. Okay. Youth, Sport and Recreation, Head 20, for those who are reading through their budget brief. Mr. Chairman, I will now present the financial year 2021 estimates of expenditure and revenue for Head 20, the Department of Youth, Sport and Recreation, which can be found on pages B254 to B260 of the estimates book. The mission statement, Mr. Chairman, in preparation of their estimates of revenue and expenditure, the Department of Youth, Sport and Recreation also conducted a review of its programs and its mission statement with the resulting revised mission statement as highlighted on page B254 as to develop youth, sport, and recreation through our services and to celebrate the accomplishments of our people. The department's objectives, Mr. Chairman, for 2021 are as follows: to modernize policies and procedures enforcing industry standards, to provide guidance to ensure that all national sports governing bodies develop sustainable, long-term athlete development strategic plans, to develop and implement curriculum guidelines to ensure accreditation standards are maintained. Mr. Chairman, the Department of Youth, Sport and Recreation administers 9 programs and 21 business units for which a general summary is contained on pages B255 and B256 of the estimates of expenditure and revenue for financial year 2021. The budget allocation for the Department of Youth, Sport and Recreation in financial year 2021 is $10,109,000 as shown on page B256. This is the same as the original budget estimate of $10,109,000 for this current financial year 1920. Mr. Chairman, I will now discuss the individual programs under Head 20. Program 2001, Administration and Sports, found on page B255, shows that the budget allocation for Business Unit 30045, General Administration for 2021 is $1,616,000. This represents an increase of $10,000 over the original budget of $1,606,000 in 1920, a 1% increase. Mr. Chairman, the allocated funds provide for administration and operations of the Department of Youth, Sport and Recreation headquarters, which is located in Craig Appen House, situated at 8 Wesley Street, Hamilton. In addition, the administration section provides administrative support for the 8 programs within the department and is responsible for monitoring departmental spending to ensure that policies and procedures are adhered to in achieving efficiency and effectiveness. Program 2002, Sport Development, provides through business unit 30055 sports programs. The financial year 2021 is $1,781,000, a decrease of $20,000 or 1% compared to the original budget of $1,801,000 in 1920. This allocation includes grant funding for the national sports governing bodies and operational costs involved with facilitating major events during the fiscal year, such as annual sports awards and national junior athlete sponsorship programs. Mr. Chairman, included in Business Unit 30055 is a grant of $650,000 to Bermuda Sport Anti-Doping Authority, known as Posada. Funding for this agency, which takes its legislative mandate from the Anti-Doping in Sports Act 2011 and operates under the global framework of the World Anti-Doping Agency, WADA, is one of the most important financial items within the sports development section. The Bermuda Sport Anti-Doping Authority is the national anti-doping organization, NADO, for Bermuda. Without the functional presence of this organization in Bermuda, It would simply mean that Bermuda would not be able to participate in any international sporting events abroad or host any international sporting events locally. Mr. Chairman, under the strict control of the Sports Development Section, the department continues to ensure that funds used by the national sports governing bodies are for the development of sport in Bermuda for our senior and junior athletes. Business Unit 30055 also provides for a grant to the Bermuda Football Association for $300,000 and $25,000 for the department's Sports Initiatives Program. An additional $156,000 in operating costs is covered under this business unit. Mr. Chairman, during the financial year 2021, the Department of Youth, Sport, and Recreation intends to continue focusing on all aspects of sporting development. That is, the development of athletes at senior and junior levels and the provision of education to local coaches and administrators through partnerships with overseas agencies such as Positive Coaching Alliance and Sports for Life, because they are key aspects in the development, and they're key in the business unit 30055. An increase of $58,000 in grant funding is provided to the national sports governing bodies. This is vital for the continued development of sports island-wide, as without this support, many athletes and sporting programs would suffer. The department will also continue to work with various government agencies to maintain sporting and recreational facilities that fall under the department's remit. Mr. Chairman, government has reestablished a sports recognition policy that requires all current national sports governing bodies to be recertified. This will ensure that all national sports governing bodies are in compliance with the department's requirements and meet minimum standards for sporting organizations. In September 2019, the department held a conference to offer personal development to coaches and administrators alike. Through a partnership with Sport for Life, NSGBs, or National Sports Governing Bodies, were introduced to the details of long-term athlete development, LTAD, or Altair. The underlying aim of Altair framework is to match the coaching and development of children to their physical and psychological growth while optimizing both their enjoyment and training. Matching training to development should allow every individual to reach their optimum potential and enjoy sports participation. In partnership with the Bermuda Olympic Association, it is intended that all NSGBs develop Altair plans for their respective sports. Program 2003, Sports Incentives and Awards. Mr. Chairman, there's no change to the estimate for Business Unit 30030 Athletic Awards, which remains at $200,000 in support of the Elite Athletes Assistance Fund and the National Junior Sponsorship Fund. The National Junior Athlete Sponsorship Fund remains at $100,000. This will assist 2 young athletes, a male and a female, from each national sports governing body who will benefit from the program. The plan is to further assist with the development of all in sport, irrespective of gender. These funds will continue to support, encourage, and provide incentives to our junior athletes to strive for excellence in their sporting development. Mr. Chairman, the Elite Athletes Assistance Fund of $100,000, as shown on page C20, is managed by the Bermuda Olympic Association, which prescribes the requirements for athletes to receive funding having met a local A, B, or C standard in their development. Program 2004, Sports Facilities Management. Mr. Chairman, the department carries out sports facilities management across 5 business units with allocations for 2021 totaling $1,897,000, as shown on page B255. This represents a decrease of $23,000 or 1% from the original estimate of $1,920,000 for financial year 1920. Mr. Chairman, the budget estimate for Business Unit 30060 Sports Facilities Administration of $1,285,000 for year 2021 is an increase of $1,000 over the original budget estimates for 1920. This increase in funds is for the signage for fields under the department's remit. Mr. Chairman, 30060 Business Unit funding also provides for the maintenance of parks under the department's remit, namely WAMC Pre-Softball Park 30075, WER Jill Tennis Stadium 30080, Motorsport Park 30090, and Sports Community Fields 30390. The WAMC Pre-Softball Stadium Business Unit provides for 2 full-time employees to maintain the grounds and includes funding for materials, supplies, and electricity. The WER Jill Tennis Stadium includes estimates for 4 full-time and 2 part-time employees, together with operational expenditure. The Motorsport Park, Cost Center 30090, shows a decrease of $29,000. The reduction is due to the fact that the Motorsport Park was transferred from Skyport to the Ministry of Public Works, and rent is no longer due. Program 2005, Youth Development. Mr. Chairman, the allocated budget for 2021 of $492,000 is for 2 of the business units under Youth Development Program. Youth Development Administration 30210 has a budget allocation of $292,000 for 2021, a decrease of $1,000 from 1920. Mr. Chairman, the facilitation of platforms for youth to have input in their development is key in engaging Bermuda's youth. With assistance from the Department of Statistics, the department will review data gathered over the financial year of 1920 to ensure that the youth engagement participation policy is sound. The department's mantra, developing youth through sport and recreation, will continue through the maintenance of its community partnerships. The Department of Youth, Sport, and Recreation will consult with youth organizations and affiliate organizations during the year 2021 to finalize the youth engagement and participation policy during 2021. Mr. Chairman, Business Unit 3050, Youth Grants, budget estimate of $200,000 for financial year 2021 is the same as 1920. The youth grant funding will be allocated to assist youth organizations and support youth programming whose focus is on developing youth to promote good citizenship of Bermuda's youth. Mr. Chairman, page C24 details the expenditure for financial year 18-19 for youth grants total $14,000. These include Bermuda Alumni Chapter, $15,000, Bermuda Badminton Association, $7,000, Bermuda National Gallery, $5,000, Bermuda Overseas Missions, $10,000, Bermuda Riding for the Disabled /WinReach, $10,000, Bermuda Sea Cadets, $20,000, Bermuda Sloop Foundation Youth Sailing, $10,000, Bermuda Volleyball Association, $8,000, Big Brothers and Big Sisters Association, $10,000, Epsilon Theta Lambda and Alpha Phi Alpha, $10,000. Gina Productions, 21,000. Grotto Bay Tennis Club, 8,000. Raleigh International, 20,000. Troika, 3,000. YouthNet, 7,000. Youth Vision Promotions, $3,000. Program 2006, Community Centers. Mr. Chairman, the budget allocation for the 3 community centers under the department's remit, which are the Sammy Wilson Central Zone Community Center, Business Unit 30120, the Eastern Zone Community Center, Business Unit 30130, and the Western Zone Community Center, Business Unit 30146, is $1,484,000, which is an increase of $55,000 or 4% over the original estimate of financial year 1920. The uplift is required to cover the wages for vacation and camps. The community center's full-time equivalent count is 19 for financial year 1920. The staff facilitate a wide range of programming for seniors, adults, and children, providing engagement and participation opportunities for families whilst promoting the philosophy of the department's mission. Mr. Chairman, the 3 community centers provide a safe, structured program with trained staff and an opportunity to build positive and long-lasting relationships. The community centers provide opportunities for residents of all ages to experience positive recreational activities. The community centers have recently come online with the after-school program to provide the same caliber of service to communities at both ends of the islands. Mr. Chairman, Program 2007, Camping. The Department of Youth, Sports, and Recreation's budget allocation of $961,000 for financial year 2021, a decrease of $175,000 or 15% from the previous year. The decrease reflects the closure of Messina House camping facility and the subsequent cost savings. Mr. Chairman, the Messina House camping facility is owned by West End Development Corporation, WEDCO, and was rented to the Minister of Public Works, who in turn rented it to the Department of Youth, Sport, and Recreation. The department then rented the facility to individuals and groups for recreational and camping purposes. The facility is in poor condition and costs some $260,000 per annum to rent and operate, while being used on average only 100 days out of each year, generating on average $6,000 per year in camping fees. As there are 4 other government-owned camping facilities available, and with the lack of use, we could no longer justify the cost of retaining this facility. Some of the savings from the closure of Messina House have been transferred to the summer day camp program to allow for expansion. Mr. Chairman, the allocated budget for the camping program provides for the staffing, operation, and administration of 4 camping facilities in financial year 2021. The camping program includes a total of 9 full-time employees who maintain the facilities and the marine vessels. Mr. Chairman, the camping facilities under the remit of the Department of Youth, Sport, and Recreation are Darrell's Island, which is the largest facility with 14 rustic campsites accommodating 30 campers at each site. There is also an additional building that can accommodate an additional 30 campers. Paget Island is located in St. George's Harbor and has the largest building and single campsite, accommodating a maximum of 95 campers. Ports Island is the oldest camping facility, which houses a building that accommodates a maximum of 45 campers. White's Island is used sporadically for overnight tent camping. It is primarily used for basic swimming instruction by the Bermuda Amateur Swimming Association and rowing instruction by the Bermuda Rowing Association. Program 2008, School Age Activities. Mr. Chairman, the estimate is being is being increased from $583,000 in the original budget of 1920 to $733,000 in 2021. This represents an increase of $150,000 or 26%. The increase reflects the redistribution of funds to this cost center from savings made from the closure of Messina House. This enables funds to be placed in the summer day camp program to ensure that more children are able to participate in a safe and creative environment. Mr. Chairman, this program supports approximately 1,500 school-aged children and is provided at various schools and community centers throughout the island. Approximately 130 part-time employees, which consist of 80% university, college, and high school students who conduct this program and are supervised by qualified teachers. There is also a special needs program that provides one-on-one care for children who have various needs. For the purposes of inclusion of all students, the special need camp is incorporated in the school-age camps. Mr. Chairman, as included in Program 2008 are 3 preschool age camps, which were created specifically for the transition of children from preschool into primary school. Program 2009, the after-school programs. Mr. Chairman, the after-school programs operated by the Department of Youth, Sport, and Recreation provide for staffing, communications, materials, and supplies for 14 programs at government primary schools. The schools that host these programs include Francis Patton, Harrington Sound, Elliott, Prospect, West Pembroke, Paget Primary, Purvis, Heron Bay, Port Royal, Dalton Itaka, the Eastern Zone Community Center 1, which is the middle, for middle schools, the Eastern Zone Community Center 2, primary schools, Sammy Wilson Center Zone Community Center, and the Western Zone Community Center. The budget allocation for Business Unit 30125 After School Program financial year 2021 is $945,000, which is an increase of $4,000 from the original budget estimate of $940,000 in 1920. This increase in funding is required to replace sport and recreation equipment. The program supports a maximum of 450 primary and middle school aged children across 14 facilities and employs approximately 26 full-time employees, which equates to 61% seasonal staff in financial year 2021. The department is committed to providing quality after-school programs for primary and middle school age children, ensuring a safe and structured recreational program. Grants and contributions. Mr. Chairman, the budget estimate for grants and contributions as shown on page C20 for financial year 1920 is $3,235,000, which is an increase of $10,000 in the sports grant allocation in comparison with the original budget of $3,225,000 for the financial year 18-19. This allocation will be dispersed as follows: grants to external bodies, $10,000. Sports Development, 6886, Department of Youth, Sport, and Recreation Swimming Program, $25,000. 6878, Contribution to Sports Development to be allocated among 34 national sports governing bodies, which includes $650,000 for the Anti-Doping Authority, Posada, is $1.7 million. Sports Incentives and Awards Program, 6880, Elite Athlete Fund, $100,000. Sports Facilities Management, 6884, National Stadium Trustees, $1.2 million. Youth Development, 6882 Voluntary Youth Organization, $200,000 for a grand total of $3,235,000. Mr. Chairman, page C23 details the expenditure for year 18-19. And I just highlight a few. The Bermuda National Athletic Association received $105,000. The Cricket Board, $100,000. Bermuda Amateur Swimming Association, $25,000. Bermuda Bicycle Association, $40,000. And the Bermuda Olympic Association, $270,000. Capital acquisitions, Mr. Chairman. The budget estimate for capital acquisitions for 2021 on page C14 is $39,000, an increase of $7,000 from $32,000 original budget for 1920. The funds will provide for a much-needed reverse osmosis system on Paget Island to ensure a clean and plentiful supply of water. Mr. Chairman, I now turn to the subjective analysis of current account estimates for Head 20, found on page B256 of the estimates book. I will now focus the subjective analysis for Head 20 and to be on page B256 and the employee numbers found on B257. The budget for financial year 2021 of $10,109,000 reflects no change. Whilst the overall budget remains unchanged, a part of the review and remains unchanged as a part of the review and zero-based budget process. There has been quite a few changes in the budget program. However, I will speak only to those object codes where there are major changes. For wages, Mr. Chairman, in the financial year 2021, the allocated budget for wages is $2,730,000. This is an increase of $201,000 or 8% compared to the original allocation in 1920 budget year. This increase is as a result of reallocation of funds for employees who should have been classified under wages and a reflection of mandatory overtime expenditure. Other personnel costs, Mr. Chairman, the budget allocation is $62,000 for other personnel costs in financial year 2021, a decrease of $34,000 or 35% from 1920. The decrease reflects the closure of Messina House and the related costs to operate. Transport, Mr. Chairman, the budget allocation for transport in financial year 2021 is $7,000, which is a decrease of $3,000 or 30% from the financial year 1920. This savings was made by a simple change of having the vendor come to our establishment rather than transporting the children to various venues. Travel, Mr. Chairman, $81,000 is allocated for financial year 2021. This is an increase of $15,000 or 23% compared to the original budget of $66,000 in financial year 1920. The Department of Youth, Sport, and Recreation increased the expenditure for travel in order to facilitate staff participation in relevant courses, conferences offered overseas, which are deemed necessary to further strengthen and develop staff capabilities and competencies that will benefit both their professional growth and the level of services provided by the department. The courses include those with Search Institute, Character Counts Program to recertify staff. Communications, Mr. Chairman, the estimate for communications has been increased by $7,000 to $96,000 or 8% compared to the original budget for financial year 1920 of $89,000. This reflects the need to equip van drivers at the community centers with cellular phones to ensure that they can be contacted at all times or make contact when faced with emergencies and the like. Professional services, Mr. Chairman, $173,000 has been estimated for this area for financial year 2021. This is a decrease of $36,000 or 17% compared to financial year 1920. This decrease was made in an effort to reduce costs in the area of recreational services, services that were often provided by external agencies will be reviewed and creative lower-cost alternatives will be found in-house. Rentals, Mr. Chairman, has a budget allocation for rentals is $276,000 for financial year 2021. This is a decrease of $187,000 or 40% from 1920. This decrease is part of the rent in respect of Messina House. Energy, Mr. Chairman, a decrease of $10,000 in the estimate for energy in financial year 2021, with a total estimate of $214,000 as compared with the original in 1920. The department will continue to encourage staff to assist in conserving energy by turning off lights, shutting down equipment when not in use, together with other energy-saving measures. Clothing, uniform, and laundry, Mr. Chairman, the $24,000 estimate allocation for the supplies in financial year 2021 represents an increase of $4,000 or 20% compared to the original estimate of 1920. This is due to increased costs associated with these items. Equipment, both major and minor capital. Mr. Chairman, the estimated budget for equipment in financial year 2021 is $16,000, which is a decrease of $8,000 or 33% decrease from 1920 budget of $24,000. This reduction reflects the fact that equipment purchased in the last budget year does not need to be replaced for this upcoming financial year. Revenue, Mr. Chairman, as shown on page B257, it is anticipated that the revenue for the department will be $670,000 for 2021, which is an increase of $73,000 or 12% compared to the original estimate for 1920. The increase in revenue is primarily in 2 hours, 8315 registration and 8665 after-school vouchers, which reflects the increased demand and success of these services, which provide working parents with a cost-effective alternative to private sector services. Full-time equivalents. The employee numbers or full-time equivalent count for financial year 2021 stands at 95, which is a reduction of 1 owing to the closure of Messina House with the employee taking early retirement. Mr. Chairman, I would like to take this opportunity to thank the director, Mr. Norbert Simons, and all of the dedicated staff at the Department of Youth, Sport, and Recreation for the work they do in advancing amateur sport, recreation, and youth development for all, which enhances the quality of life for residents of Bermuda. Mr. Chairman, in this Olympic year, it is important for me to recognize the significant contributions made by our sportsmen and sportswomen and the pivotal role they play in inspiring our youth to achieve their true potential. I wish all much success, particularly those having already qualified to participate. Mr. Chairman, this concludes my presentation on the financial year 2021 budgetary allocation for Head 20, the Department of Youth, Sport, and Recreation.
Continue, Minister. Yes, continue.
Okay, thank you, Mr. Chairman. I will continue with Head 52. Head 52, which is the Department of Community and Cultural Affairs, can be found on pages B6 B261 through pages B269 of the estimates book. Mr. Chairman, the department has a revised mission statement, which is to develop our creatives, preserve our heritage, and celebrate our people. The department's objectives for 2021 are as follows, Mr. Chairman. To support Bermuda's cultural heritage and artistic communities and institutions through developmental programs and partnerships. To preserve our heritage by promoting an understanding of Bermuda's cultural identity through education, research, publication, and enrichment programs. To celebrate our people and the development of our national identity by curating cultural festivals, public discussions, and educational programs, and to serve as stewards of the Bermuda's cultural heritage. Mr. Chairman, the Department of Community and Cultural Affairs administers 2 programs and 13 business units for which a general summary is contained on page B262 of the Estimates of Expenditure and Revenue for financial year 2021, with a total estimate of $2,083,000. The general summary for Head 52. Under Unit 5202, Cultural Affairs, line item 62000, grants to organizations is $229,000. 62001, administration is $836,000. 62010, cultural festivities and celebrations, $77,000. 62020, heritage celebrations, $274,000. 62030, cultural education program, $62,000. 62050, National Heroes Day, $62,000. 62060, promotion of the arts, $76,000. 62070, Folk Life Bermuda, $106,000. 62080, research and publication, $56,000. 62180, special projects, $41,000. 62210, Gombe Festival, $98,000. And under the business unit 5203, community services, line item 62100, Uncover the Arts, $133,000. And 62130, Senior Citizens Projects, $33,000, for a total, as stated, of $2,083,000. Mr. Chairman, the 2 programs and 13 business units will now be discussed in order of appearance as shown on page B262. Mr. Chairman, shall I continue or did you want me to stop here? I can continue, that's not a
We have
problem.
10 minutes.
Okay,
to go,
thank
so
you.
I would think.
'Cause I
we
wasn't
need
aware of the time.
Yeah, please.
Thank you. Program 5202, Cultural Affairs, Mr. Chairman. Business Unit 62000, grants to organizations. Mr. Chairman, the total amount budgeted under this business unit for financial year 2021 is $229,000, which is the same level of expenditure compared to 1920 original budget allocation. As part of a review by the department aimed at streamlining and better regulating the process by which individual students and organizations apply and receive grants for cultural and artistic projects, the Bermuda Arts Council's grant has been increased from $100,000 to $131,000, representing an increase of 31%. This was achieved by way of a reallocation of funds within this business unit, primarily by allocating $25,000 formerly reserved for the Cultural Legacy Fund as part of the overall Arts Council grant. This was deemed to be a more efficient process since in the past, the Arts Council assumed the responsibility of reviewing the applications and making recommendations. The Department of Community and Cultural Affairs is responsible for promoting, preserving, and celebrating Bermuda's rich and diverse cultural heritage and also for the arts. These goals are achieved in part by partnering with private sector organizations by providing funding. Organizations that will receive financial support in the upcoming fiscal year are as follows. Bermuda Historical Society, $10,000. The St. George's Historical Society, $10,000. St. George's Preservation Authority, $10,000. Bermuda Arts Council, $131,000. Bermuda Heritage Association, $10,000. Bermuda National Gallery, $48,000. The Cultural Legacy Fund recipients, because it's been changed, 0. And the St. George's Foundation, $10,000 for a total of $229,000. For financial year 2021, each of the heritage institutions will receive a grant of $10,000, consistent across the board. Being a recipient of these grants does not preclude these institutions or others that did not receive grants this financial year from applying directly to the Department of Community and Cultural Affairs to request contributions supporting specific cultural and heritage programs, events, and projects. Under Business Unit 62001, Administration, Mr. Chairman, the function of this business unit is to provide for the administration and operation of the Department of Community and Cultural Affairs, which is located on the 4th floor of the Dame Lewis Brown Evans building. Mr. Chairman, the allocated budget for financial year 2021 for this business unit is $836,000 as shown on page B262. This amount reflects a decrease of $10,000 or 1% compared to the original budget for financial year 1920 of $846,000. This minor decrease is the result of the department's website not requiring major upgrades. Mr. Chairman, the allocated budget sustains both programs of operation, including salaries, wages, and professional development. The remainder of the budget provides for the department-wide promotion, office supplies, copies, website maintenance, and telephone services. Mr. Chairman, Business Unit 62010, the Emancipation of Cultural Festivities. The total amount allocated for this business unit in financial year 2021 is $77,000, a reflection of an increase of 24% or $15,000 compared to the original budget for financial year 1920 of $62,000. This increase can be attributed to an expanded scope of the program intended to honor more of Bermuda's root cultures. Mr. Chairman, this business unit covers the cost of promoting the culture and heritage of Bermuda's citizenry through festivals and other programs and events, and is aligned with one of the primary departmental objectives of celebrating our people. The costs associated with programs and initiatives with the department promotes and hosts that are covered in this business unit include the Emancipation of the Commemorative event and Harbor Night. Mr. Chairman, permit me to expand on these events. The Emancipation Commemorative event was first established as a way of recognizing the complicated history of Bermudians of African descent, a history that includes enslavement, segregation, and its aftermath. It is clear that more research regarding African Bermudian history is both important and necessary. For this reason, in 2019, the department placed a strong emphasis on supporting work by professional historians intended to shed light on contributions of Black Bermudians that extended beyond our shores to the world stage. The primary event for the 1920 financial year was a public lecture by Margot Madison McFadden, outlining in superb detail the research she has conducted, supported by the Department of Community and Cultural Affairs, which sheds light on the latter days of our national hero, Mary Prince. This event was punctuated by additional programming, including a Mary Prince Legacy Bus Tour in collaboration with Titan Tours, an educational Instagram campaign, 2 lectures by Dr. Arnold Rampersad, the first on African-American poet and activist Langston Hughes, and the second on the importance of autobiography, including Mary Prince's story at the heart of the abolitionist movement that resulted in emancipation throughout the British Empire. Funds allotted to this business unit, 62010 in financial year 2021, will be used to support a research project by Dr. Dana Selassie entitled Broadcasting Black, exploring the role that Black Bermudian broadcasters played in the era immediately after the ending of segregation. This project will result in a documentary film as well as a collection of oral history transcripts that will be incorporated into the department's archive. The department will also look to expand its support to Bermuda's root culture by providing assistance to the St. David's Islander and Native community for the hosting of their biennial powwow in June 2020. Business Unit 620.
Minister, we are about 2 minutes away from lunch. Will you complete
I
the
can
next
finish
minute?
this page and it should be less than 2 minutes.
Okay.
Okay. Business Unit 62020 Heritage Celebrations. Mr. Chairman, the total amount budgeted for this business unit for financial year 2021 is $274,000, an increase of $12,000 or 5% when compared to the original budget of 1920 of $262,000. This increase can be attributed to increasing infrastructure costs by external vendors and planning for a Heritage Month cultural conference. Mr. Chairman, this business unit covers the cost of both heritage celebrations and the Bermuda Day Parade. Heritage celebrations are a year-long series of cultural events and activities, the crown jewel of which is the vibrant Bermuda Day Parade. I can stop here if you would like, Mr. Chairman.
Thank you, Minister.
Yeah.
Deputy, would you?
Afternoon, Mr. Chairman. I do move that we adjourn till 2 p.m.
Members, we are adjourning until 2 p.m.